Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers. How are the people faring who lived near the major Ukrainian hydroelectric dam that was destroyed in early June? The answers are complicated. Today, Stephanie Desmon talks to Dr. Heather Papowitz, a WHO incident manager for the region, about the immediate public health risks for those who rely on the dam and the long-term ones. Let's listen. Heather Papowitz, thanks so much for joining me.
Thank you. It's a real pleasure to be here. Thanks for inviting me.
So I wanted to talk to you today about the public health situation in Ukraine, but most specifically, we've all read about how in June, a major hydroelectric dam in Ukraine was destroyed. And I'm curious what the health effects have been since then.
Great. Thank you. And good question. First, I want to talk a bit about the complexity of the situation, and that really impacts the public health risks and the ability to respond. So this region, the area where the dam is exposed to significant hostilities. So this is a really hot zone. So there's already challenges to access the area and to respond. Where the dam is also right in the middle of Ukraine, and it's half happened in Ukraine and half in the area that is temporarily occupied by the Russian Federation. So that also makes it more complex. And there we really have no data and no capacity to provide humanitarian response. It resides on the Dnipro River, and the dam provides hydroelectric power, water for agriculture, irrigation, and drinking water. It's a drinking water source for over 700,000 people. And it's the water for the cooling of the Zaporizhzhia nuclear power plant reactors. There's a high concentration of industrial facilities in the affected area that could spill hazardous chemicals if flooded, including fuel, corrosive chemicals, industrial and agricultural chemicals. So that's another risk in the region. This is also an area, and there's a lot of mines and unexploded ordnances, but this area is really one of the most heavily mined area. So that also adds another dimension. And the communities and also the health system in that area has had over a year of war. So they're exhausted. And we've already had a lot of damage of health facilities and health systems in that area. And also in the south and the east, there's ongoing humanitarian response. So this isn't the only thing that's happening. We have a whole response capacity going on in another region. So we have reduced capacity to respond to that area. So you can see that this is really truly a complex humanitarian situation. There's a lot happening in that area. But on the other hand, the government has been responding to the crisis for over a year. So with support from partners, this has really significantly increased capacity to respond to crises. So they've ramped up supply chains. They've trained and increased capacity of the health staff. There's been coordination and mobilization of partners, also prioritizing and expanding public health services across the country. So they've been responding for over a year and a half. So when this happened, they were able to mobilize probably faster than before the war. So this is really all goes into your risk equation. So you have your capacities, your vulnerabilities, and that really influences the public health risk. All of this is going on. And then we have the destruction of the dam. So we have both the downstream flooding, but the upstream, we also have the reservoir and the draining of the reservoir. And I discussed a few pieces of that puzzle already. So this is really the context we're dealing with. And I'll just go into the public health risks now, unless you have any other questions on the context. We have the immediate public health risks, and then we have more medium and long-term risks. So in flooding, the first health risks that you have, and really what leads to the highest amount of mortality, is drowning. So that's really the first thing, and it has the highest mortality at the beginning of a flood. Also trauma and injuries, and this is all direct impact from the water and the flooding. Then we also have destroyed health facilities and healthcare access. So if you have, let's say, have an obstetrical complication, you'll have nowhere to go. So that can really kind of have the indirect morbidity and mortality for illness and death from that. Also, cardiovascular emergencies. So any of those acute needs that you have. As I said before, you have the dislodged mines and unexploded ordinances. And then you have just acute mental health risks. And this is throughout the whole response. And really, the mental health impact has been huge, both in Ukraine, but also in the refugee receiving countries. So that's the immediate. And we're actually over the immediate phase already. And we're into more of the medium and longer term risks. And this is where we start seeing our infectious hazards. So our diarrheal diseases, really having that lack of access to safe water, sanitation, hygiene, and food safety. So we start seeing our food and waterborne diseases coming in as a higher risk. And then some other infectious diseases. Again, disrupted health services, and this is going into inability to take care of your chronic diseases, your diabetes, your high blood pressure, maternal, newborn, and child health issues. If you have tuberculosis, you may not be able to go get your medicine. So again, that disrupted health services. Some of the displacement and crowding. So when people are moving and they'll crowd in one household or temporary shelters, you have increased risk of respiratory diseases, such as influenza, things like that, but also other diseases like measles that are transmitted quickly if everybody's together and your vaccine coverage is not high. Again, chemical hazards, as I mentioned before, and that really depends on the type and exposure to the chemicals. Trauma from mines and unexploded ordinances. And these, like the areas where they have moved, they haven't had the kind of exposure, the communication material to help them understand how to stay away from them. So it's really a new risk. The nuclear power plant, and I'm sure everybody has heard a lot about that on the news. The water in the reservoir is used to cool the reactors, and that has really been monitored very closely. There's been additional staff put in to monitor that, but apparently that there's enough capacity to keep that cool. Mental health, again, this comes into play over and over again, the long-term effect of the war. And here is just another event on top of all of that everybody has to deal with. And then longer term, even like the reduction in agriculture. So, the water supply was the irrigation for the whole, for the South, and the production of grains that are provided to Ukraine, but also globally. And I think a lot of us have heard that. And recently they're going to be having additional talks on some of the grain distribution. So this is really part of that whole wider picture. So the huge impact in Ukraine, but also globally. So that's a main picture, and I can get into some of what we've done, but maybe you have some questions on the context on that.
It sounds like a massive disaster on top of a disaster that was already happening.
Yes. Yes.
What is it like there on the ground? I mean, I know you're not there right now, but I mean, is the flooding permanent? Are there efforts to repair the dam? I mean, I know we're in the middle of a war, so I'm just curious.
Well, I'll just go over some of the public health actions that were taken by the government and partners. I mean, just starting by what it's like being there. And I go in on a regular basis. And the last time I was there, I went through Odessa and Dnipro and then up to Tava and Kyiv. So I did a trip. But just when I'm meeting with the team there or going to see field sites, you have regular air raid alarms. So you're working, you're meetings, you're discussing stuff, you're going over response activities, and then there's an alarm and you have to go down to the bunker. And then it's over, and you have to go up, and then you start again, and there's an alarm, and you have to go down to the bunker, and then you go back up. And then if there's any field distribution or any field sites that you have to go to, this is also disrupted by these types of things. At night, they also go off. So you wake up, you go down to the bunker. So you can imagine how exhausted the team is there, working 24/7 to provide services, but then also challenges in getting work done and getting sleep. So it's a tough situation for them. I mean, I can imagine for the people living there, and you just never really know what's going to happen and when. And we see, I mean, the dam is one thing, but it's a really acute and volatile situation. It's a tough working environment. But even with that, we've managed to, for the dam support, really pull together all of our partners to help the government deliver services. So that's really important to make sure we're all working together, to make sure we coordinate efforts, doing the risk and needs assessment. So what is actually needed out there? So before we run out there and help out, what do we think is the best way we can provide services? The government actually sent out pretty quickly emergency medical services, and that partners help support that. So really making sure there's health services right there to deal with trauma, somebody who's having a baby, somebody who has anything that needs a quick help, including mental health. There's a lot of mental health support that happened there. Supplies were sent in, medical supplies, laboratory supplies, food, water. I mean, we were just talking about waterborne diseases and how important it is to have clean water. I mean, that's really one of our biggest risks. So that was very important to get that in quickly, make sure people have housing, some of the basic services, surveillance systems, making sure we're able to quickly detect if there is an outbreak or any infectious hazards of concern, and then respond to that. So teams were sent out immediately and really stepped up that surveillance. Communication, we have to talk to people, tell them what is happening, where they go for help, how to protect themselves from diarrheal diseases or mines, and just make sure they know how best to manage. I mean, that's a kind of in a nutshell. I mean, there's a lot that was going on, but we also have to continue our regular services. So there's still action at the front line. There's still support that's needed there, the east and the south. So continuing all of our services, but also trying to prioritize that at the same time. And then, I mean, the other part is really, as I said, half of this response is in Ukraine and half in the areas that are temporarily occupied by the Russian Federation, continuing to advocate for access there. And we've been doing that all along, but that's really important because we don't really know, and it's important to provide services there. So that's it in a nutshell. And just to continue to monitor and provide support. So that's ongoing.
It's not like you can go in there and fix the dam right now.
No, well, definitely not us. But yeah, absolutely.
Yeah. So, I mean, I guess, how are those folks surviving? Have a lot of them moved away? I mean, are they refugees somewhere else now?
No, I think, a lot of people didn't want to leave. I think they were tired of moving around and they wanted to stay as close to home as possible. And I think that's where most people do want to do in general, is stay as close as they can. So there are some people that were evacuated but sent not too far, stayed relatively local. I think it's going to take some time to clean up the damage and to make sure it's safe, especially from some of the mines farther down, but other risks as well. So it'll take time for sure. And we may see some longer term effects, as I was saying, even just agriculture, but also looking at some of the chemicals that were spilled as the flood water recedes, making sure that area is safe. So I don't think refugee-wise, a lot of people really left the country. So they're staying around there. So yes, continued work to do. And again, it's like volatile and acute. And there's one thing that just happened that as we're responding, we don't expect something else. I mean, we should, but then that just happened on top of everything else. So it was really a tough time for them.
And I guess it makes you wonder, I mean, how do you figure out where to start in a situation like this? I mean, there's so much going on. How do you all prioritize?
Well, I think, really the coordination is important. And that's why I put that first on the list, because you could go anywhere and everywhere and do what you think is right, but you have to pull everybody together and sit in a room, or actually in the field at this point, and look at what the risks are. So you do a risk assessment and you look at what capacity is out there, what's available to support, what are the vulnerabilities in population and of the health system, where's the exposure area, who's exposed, how many people are exposed. And you put that all together and it gives you an analysis and it shows what some of the top risks are. And we've managed flooding all over the world for many years. And unfortunately, it's getting worse and worse with changing climate. And so we already have mapped out a lot of the risks. And so what we have to do is look at that within the context and see what those risks are.
Well, unfortunately, it doesn't seem like your work is going to be slowing down.
No, not the way the world is going.
Heather Papowitz, thank you so much for joining me.
My pleasure. It was a real pleasure being here. It's an important issue. Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmon. Audio production by J.B. Arbogast, Holly Cardinale, Philip Porter, Spencer Greer, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media run by Grace Fernandez and Shian Briscoe. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.